ways that I think about my work here at Baylor is that I'm teaching to my 20-year-old self. So these are the courses that I wish I would have had before I went to medical school.
You know, a lot of times when you think about medicine, you just think about an individual physically that you're dealing with. But humanities looks at that person far beyond that.
I like to tell people it's not about transmission of a quantifiable amount of scientific knowledge. It's about shaping a person's worldview, shaping who you are, what you believe in, and how to do your job in a compassionate, thoughtful way.
So if we only are seeing the world of chemistry, if we're only seeing a world of physics, if we're only seeing a world of biology at the cellular level, we're missing out on an entire world of experience. And that world of human experience is contained in the humanities. That's what the humanities are about.
Medical humanities is an interdisciplinary or multidisciplinary field that lies at the intersection of medicine, healthcare, public health, the health sciences, that whole universe, with the humanities as historically defined: philosophy, history, literature, arts, religion, ethics. But here at Baylor, we also fold in the behavioral and social sciences, and we fold in also as well a big dose of clinical experience, person-to-person contact.
We need to be fluent in the sciences if we're going to be in healthcare. If we're going to practice medicine, we have to have that. But that needs to be supplemented and complemented by the humanities, I think, to help train a healthcare practitioner who can see the whole person and not just see them as parts.
I think what the humanities do is open possibilities for thinking about the big questions of medicine, what it is to live well, what it is to die well, what it is to be sick, what it is to be healthy, and to draw answers from the world's great traditions to the questions we are going to wrestle with more and more. But it gives them the resources, an introduction to the resources, not all of them, but the introduction to ways of thinking, how to seek answers in literature, religion, philosophy, art, music, all the things the humanities bring, and ways of thinking and approaching these questions that aren't answered just always from data, but have to be answered with different kinds of thinking, and the humanities build that for the students.
Another thing we're proud of is having so many clinicians involved in the program, so that students who are planning to work in or around healthcare have mentors, and they have exemplars, and they have models for what their practice can look like one day.
There's something that enlivens the conversation about the patient's lived experience with illness and the relationship between the patient and the clinician professional. Those conversations are enlivened by clinical case material. I'm not talking about a theory that I read about in a textbook. I'm talking about a real patient whose face I see in front of me.
I am able to bring my experience as a physician and bring in real life scenarios of things that I'm battling or dealing with. Wednesday mornings I'm in clinic, and then I come directly here from clinic. So even within hours of being with my last patient, I'm sitting in front of these students, and I'm able to share the compliments and the anger directed at me, all of it. Every encompassed emotion. Can't share the medicine because they're not there yet, but I can share what I feel with that.
If what we're teaching in the classroom doesn't make a substantial difference to what happens in the clinic exam room or the hospital room, then I think we have to question that. I want to see what they're learning in these different disciplines help change who they are and help them with the quality of attention that they're able to give to patients, with the way they're able to listen to them, with the way they're able to observe them, and with the way they're able to interact with them as whole people.
There's another way that we can impact the lives of students, not just through modeling professional behaviors, but because this is a faith-based school, it's a private institution, we can express our caring and our love and our concern for our students in ways that maybe would not be possible in public institutions.
You know, when I was a medical student, it really wasn't considered proper or appropriate to talk about your own faith or to talk about a patient's faith with them. It just really was not considered part of what medicine involves. But these days, there's much more of an understanding of how much religious practice and religious faith shapes medical decision making all through life, but particularly at the end of life. And so we're starting to understand that it's just as important to take a spiritual history as it is to take a medical history, a surgical history, a social history, a family history, and that people's religious heritage really, really informs how they want to be treated by the healthcare team. And that is an important part of the whole picture of a human that we need to treat, not just their pathology, but who they are as people. And so we really want to embrace and reclaim that Christian heritage in the way that we educate students to work in and around healthcare.
You're dealing with a body and a soul and a spirit made in the image of God. And when all of those come together, it drives you and gives you the motivation to give the very best health care you can, because again, you're looking at them holistically. And you realize that not only are what you're doing is making a difference temporally, it's making a difference eternally. And there's a lot of satisfaction in teaching in that way.
Before I ever lecture in a class or before I meet with a student, I pray for them. And usually sitting in my office, and I've taught small seminars, so I'm able to kind of go through one by one, say their name, and ask that God blesses them, and that hopefully whatever comes out of my mouth during that class will be something that will instruct them and provide them guidance and will help them flourish in their careers, whatever that may be.
I would never tell a student to interview at a secular medical school talking about their Christian virtue in those terms. But I would tell them to talk about concepts of fidelity and trust and honesty, of diligence, the kinds of things that we say are important in Christian life. When you look at the fruit of the Spirit in Galatians chapter 5, you actually read a list of things that medical schools are looking for. They just don't name it in Paul's language. They're looking for people to love patients, to care more for this patient, and to put their unremarkable good in front of my own self, my own agenda. They're looking for medical students who are joyful and who have a level of peace. But I think they're also looking for people who are patient and are faithful and are gentle. And so I encourage students when they're interviewing to think not about the skills they have attained and not about the grades they have earned, but about the character they have developed. And I think that's what medical schools want to hear, and I think that's why they relish having our students, is because of the formation that goes on in our classes.
I think what makes our approach to medical humanities unique is centuries of sustained theological reflection within the Christian tradition that deepens and enlivens and enriches our curriculum, our teachers, our classes, and also is welcoming and fully embraces people from all walks of life and all faiths, all traditions.
One day I just decided to switch my major because I committed to the fact that this is where I feel like I belong, and my heart is just calling me to medical humanities, and ever since then it's been a love affair. I will never ever regret switching my major.
I've been forced to be thoughtful about why I think a certain way, why I believe what I believe, what my vocation is, why I'm doing what I want to do. So I think that's been the biggest game changer, is having to think about why I believe something and why I hold something to be true.
I'm able to go into classes and learn the material, learn the curriculum, and add that to my knowledge, but I'm able to also go to events, go to pizza parties, really interact with my faculty, and really get to know everyone, the staff, the other students, and form those relationships that really just show that everyone kind of understands the medical field on a different sort of level and a deeper level, and you're able to celebrate the human side of things and not really have it be all about the science, which you don't really find in the rest of your pre-med classes.
There's this quote I shadowed a doctor, and he said one time, "For without compassion, medicine is merely just science. What really separates medicine from it is the compassion, the love, the attentiveness, the altruism, the benevolence of the provider and of the patient, to really spread that branch into what medicine is."
I want to be a good doctor, I want to be a good person, but what does that take? It takes self-evaluation and seeing how the way you were raised may not be the full scope of the human experience, and looking at that and saying, wow, I really need a bigger perspective here to understand this person's experience.
That the years to come are going to be fantastic and exciting. You're going to learn so much in so many different aspects of what you think you would. However, it's okay to break away from the traditional STEM majors. It's okay to not get a bachelor's of science and to have to explain what your major is to people, because they'll be fascinated. People will always be talking about how unique medical humanities is, and I'm just honored to be a part of it.
Here in the Medical Humanities program at Baylor University, we're preparing anyone who's going to work in or around the bedside. So anything you can think of in a medical center. Physical therapy, occupational therapy, speech therapy. We have students who are going to be pharmacists. We have students who are going to be dentists. We also have students who are headed to law school. They're interested in healthcare policy. They're interested in healthcare law. And we have a significant contingent of our students that are headed into healthcare administration. And we are so excited about the fact that we are able to prepare all of these students that are headed into all of these different areas with a background in humanities that they're going to build the next step in their training on. It's going to take interdisciplinary teams to solve the complex problems we have. It's not going to be just doctors. It's not going to be just lawyers. It's not going to be just healthcare administrators. It's going to take all of us in all of these disciplines working together to solve the healthcare problems that we have in our country today.